what is colon cancer? Colon, colorectal, cancer starts in your colon, large intestine, the long tube that helps carry digested food to your rectum and out of your body. Colon cancer develops from certain polyps or growths in the inner lining of your colon. Healthcare providers have screening tests that detect precancerous polyps before they can become cancerous tumors. Colon cancer that's not detected or treated may spread to other areas of your body. Thanks to screening tests, early treatment, and new kinds of treatment, fewer people are dying from colon cancer. How does this condition affect people? Your colon wall is made of layers of mucous membrane, tissue, and muscle. Colon cancer starts in your mucosa, the innermost lining of your colon. It consists of cells that make and release mucus and other fluids. If these cells mutate or change, they may create a colon polyp. Over time, colon polyps may become cancerous. It usually takes about 10 years for cancer to form in a colon polyp. Left undetected and/or untreated, the cancer works its way through a layer of tissue, muscle, and the outer layer of your colon. The colon cancer may also spread to other parts of your body via your lymph nodes or your blood vessels. Who is affected by colon cancer? Colon cancer is the third most common cancer diagnosed in people in the U.S. According to the U.S. Centers for Disease Control and Prevention, CDC, men and people assigned male at birth, AMAB, are slightly more likely to develop colon cancer than women and people assigned female at birth, AFAB. Colon cancer affects more people who are Black than people who are members of other ethnic groups or races. Colon cancer typically affects people age 50 and older. Over the past 15 years, however, the number of people aged 20 to 49 with colon cancer has increased by about 1.5% each year. Medical researchers aren't sure why this is happening. What are colon cancer symptoms? You can have colon cancer without having symptoms. If you do have symptoms, you may not be sure if changes in your body are signs of colon cancer. That's because some colon cancer symptoms are similar to symptoms of less serious conditions. Common symptoms of colon cancer include blood on or in your stool, poop. Talk to a healthcare provider if you notice blood in the toilet after you poop or after wiping, or if your poop looks dark or bright red. It's important to remember blood in poop doesn't mean you have colon cancer. Other things, from hemorrhoids to anal tears to eating beets, may change your poop's appearance. But it's always better to check with a healthcare provider anytime you notice blood in or on your stool. Persistent changes in your bowel habits, how you poop. Talk to a healthcare provider if you have persistent constipation and/or diarrhea, or if you feel as if you still need to poop after going to the bathroom. Abdominal, belly pain. Talk to a healthcare provider if you have belly pain with no known cause, that doesn't go away or hurts a lot. Many things may cause belly pain, but it's always best to check with a healthcare provider if you have unusual or frequent belly pain. Bloated stomach. Like belly pain, there are many things that may make you feel bloated. Talk to a healthcare provider if your bloated belly lasts for more than a week, gets worse, or you have other symptoms like vomiting or blood in or on your poop. Unexplained weight loss. This is a noticeable drop in your body weight when you're not trying to lose weight. Vomiting. Talk to a healthcare provider if you've been vomiting periodically for no known reason or if you vomit a lot in 24 hours. Fatigue and feeling short of breath. These are symptoms of anemia. Anemia may be a sign of colon cancer. What causes colon cancer? Like all types of cancer, colon cancer happens when cells grow and divide uncontrollably. All cells in your body are constantly growing, dividing, and dying. That's how your body remains healthy and working as it should. In colon cancer, cells lining your colon and rectum keep growing and dividing even when they're supposed to die. These cancerous cells may come from polyps in your colon. Medical researchers aren't sure why some people develop precancerous colon polyps that become colon cancer. They do know certain risk factors increase people's chances of developing precancerous polyps and colon cancer. Those risk factors include certain medical conditions, including inherited conditions, and lifestyle choices. Having one or more risk factors for colon cancer doesn't mean you'll develop the condition. It just means you have increased risk. Understanding risk factors may help you decide if you should talk to a healthcare provider about your risk of developing colon, colorectal cancer. Lifestyle choices that are risk factors for colon cancer. Smoking, using tobacco products, including chewing tobacco and e-cigarettes, increases your risk of developing colon cancer. Excessive alcohol use. In general, men and people AMAB should limit beverages containing alcohol to 2 servings a day. Women and people AFAB should limit beverages containing alcohol to 1 serving a day. Even light alcohol use can increase your risk of developing cancer. Having obesity, eating high-fat, high-calorie foods may affect your weight and increase your risk of colon cancer. Having a diet that includes lots of red meat and processed meat. Processed meat includes bacon, sausage, and lunch meat. Healthcare providers recommend you limit red meat and processed meat to 2 servings a week. Medical conditions that increase colon cancer risk: inflammatory bowel disease. People who have conditions like chronic ulcerative colitis and Crohn's colitis, which cause inflammation in their colon lining, may have an increased risk of colon cancer. The risk increases if you have inflammatory bowel disease that lasts more than 7 years and affects large parts of your colon. Inherited conditions. Certain conditions like Lynch syndrome and familial adenomatous polyposis may increase your risk of developing colon cancer. Colon cancer may happen if you inherit a gene that causes cancer. A family history of colon and other kinds of cancer. If a close family member has colon cancer, you may have an increased risk of developing the condition. Close family members include your biological parents, siblings, and children. Your risk may be higher if any biological family member developed colon cancer before age 45. A family history of polyps. If your parent, sibling, or child has an advanced polyp, you may have an increased risk of getting colon cancer. An advanced polyp may be a large polyp. Medical pathologists may characterize a polyp as being advanced if they see certain changes in the polyp when they look at it under a microscope that are signs the polyp may contain cancerous cells. Colon cancer prevention for people with a high risk. Some medicines can reduce the risk of colon polyps or colon cancer. For instance, some evidence links a reduced risk of polyps and colon cancer to regular use of aspirin or aspirin-like medicines. But it's not clear what dose and what length of time would be needed to reduce the risk of colon cancer. Taking aspirin daily has some risks, including ulcers and bleeding in the digestive system. These options are generally reserved for people with a high risk of colon cancer. There isn't enough evidence to recommend these medicines to people who have an average risk of colon cancer. If you have an increased risk of colon cancer, discuss your risk factors with your healthcare team to see if preventive medicines are safe for you. By promoting balanced neurotransmitter activity. We appreciate your likes and subscriptions to our channel for more valuable insights into maintaining wellness throughout life. Wishing you a fulfilling and vibrant journey ahead.